Hi, good morning, Dr. Simmons. Thanks for
Good
joining us.
morning. Thank you. I'm happy to have this conversation.
Before we start, would you mind introducing yourself to our audience?
I'd be happy to. My name's Steph Simmons. Hi. I'm an emergency medicine trained physician, and I live in Ann Arbor, Michigan. And I'm the Vice President for Patient and Clinician Engagement at Envision Physician Services.
Okay, maybe you can tell people what that actually, because I'm going to be asking you questions a little bit about leadership and some of your challenges.
Okay, just a second. We need to pause. My apologies.
That's fine. It's fine.
Balancing being a full-time mother of three and working full-time from home. So I can tell you what it means in peacetime and what it means now during the pandemic. But basically, it means that I set the strategy for relational excellence within Envision. And what that means is how people are treating each other, right? So how our clinicians, what the expectation is around communication for our clinicians with patients and their connection with patients. And then what our expectations are for our clinicians in terms of how we're supporting their professional well-being and their experience as clinicians working within Envision Physician Services. So it's broad, right? And it can mean different things in different times and for different people and situations.
Okay. Well, thank you for that. How long have you been doing this?
Well, I've been in a role similar to this for the last 10 years. In my initial company that I worked with was Emergency Physician Medical Group, EPMG, and we became part of Envision Physician Services 4 years ago. So I was filling this role within EPMG over the past decade. And then as we became part of Envision, I started in this role in the Midwest, and then in the emergency medicine and hospitalist medicine service lines, and now for the entire company.
Okay, great. Obviously, this is something none of us have been trained for. We talk about it in theory, but I don't think we've ever actually lived it. And so being in your situation, I just, I've had an interview with Dr. Ray, and he said he has two positions, one his usual job and then the COVID-19 job.
Right.
And so, I thought that was interesting. What in your capacity right now have you seen? I know you have challenges, but with respect to the COVID-19, what are kind of like your three top challenges in achieving what you want to achieve with physicians?
Yeah, I totally agree with the statement from Dr. Ray that there's a whole nother set of challenges on top of sort of the daily operations of things. And to some extent, those daily operations have changed, right? Rightfully so, because the focus really needs to be on what we need to do to support our clinicians through the COVID pandemic. So our whole company has actually organized around this idea that we need to protect our clinicians so they can protect patients, that we need to support each other, we need to check in on each other, and we need to stay focused on getting through this successfully. So for my part in that, it has really, the shift has been from the patient experience side of what I'm doing to the clinician experience side of my work, particularly around health and well-being for our clinicians. So we've put forth a huge effort to get adequate PPE for all of our clinicians. And that's not an effort I'm in charge of, but I'm trying to help communicate that to our clinicians so they know the priority that we have. We have stood up 2 support meetings a day. One in the morning at 10 a.m. is for all of our employees, clinical and non-clinical employees, and there's an afternoon meeting for clinicians only. And during that meeting, we gather. Just sometimes that gathering can be the most important part, saying hello to each other, checking in, and then we go over about a 10-minute topic, something about stress management, how to talk to children during the pandemic, things to think about with regards to caring for older adults, positive psychology. And then we finish with a 5-minute meditation. And we've been very fortunate. A group of meditators from a company called Be Still have donated their time to lead us in these meditations every day. So we have those 2 meetings. We've put together a crisis peer support training, and we've had over 400 people took the training live as a webinar. And then it's been posted on our website for everybody to look at who wants to from the company. And it's a 90-minute seminar that we developed with our employee assistance program specifically for our clinicians and specifically for the pandemic on how to support each other, particularly our clinicians who've been caring for patients in austere environments that are resource restricted and making some very hard decisions about the type of care they provide. Then we have developed a very in-depth debriefing process for our deployed clinicians. So we have a group of clinicians who are actually traveling from their normal homes and clinical lives to the hardest hit areas in the country to work in our intensive care settings in those hospitals. When those clinicians come off deployment, we have a trauma counselor give some guidance to them in terms of what are typical responses to experiencing a traumatic scenario like that. And then we're checking in with them in the coming weeks to make sure that they're doing all right. So, yeah. No, so really the focus has been on, how do we support really the sense of community, right, of our company and of our clinicians and our non-clinical employees, but then how do we specifically address the additional challenges and stressors to our clinicians in this time?
Have you noticed any common theme amongst all the clinicians working on the front line, or, when you set all of this up, have you seen things from physicians that are pretty much common to all, whether it's fear, anxiety, or dealing with the hard decisions? Is there, have you seen an uptick, say, in watching that seminar? Anything that the physicians usually won't do?
So what I'm hearing most from people, and it's interesting because our overall patient volumes are down, even though the acuity of patients is up, right? So in some ways, our clinicians are really connected to the mission of what they're doing, right? Because this is taking care of critically ill patients is what they train to do. And it is rewarding, right? But the PPE, the masks, the goggles, the gowns are exhausting to take on and take off. And it's adding a physical challenge to the shift to just get through and to do all that. And I know you're living it, Naeem, so I feel like I'm preaching to the choir here by telling you this. So there's that extra physical stress. And then there's just, I think that one of the hardest things is seeing people who you suspect may not recover from the disease and knowing that they're isolated from their family and friends, people who would usually be attending them at the bedside. And that, emergency physicians and intensivists realize that people die, right? That's part of the reality of life. And it's something that we experience through our whole career. Having those people die alone or unattended is, it's morally painful to clinicians. And I think that's been one of the hardest parts. So a lot of people have been figuring out ways to get family members to the bedside by phone, by FaceTime, by iPad, or spending their off time just attending to those people and being with them as human being to human being. So I'm seeing a huge amount of just compassion and empathy from our clinicians to patients, which surprises me not at all. And is exactly what I would expect from this group of people. But it is a lot, right? It's a lot to bear witness to, and it's a lot to manage sort of emotionally. And then when these folks go home, they're dealing with the same thing everyone else is. They've got kids that are at home from school. They've got spouses who may or may not be working. There's financial difficulties. There's rationing. There's the mask and goggles when you grocery shop, the same that everybody else is dealing with. Just they've got a whole nother burden on top of that.
It's interesting. Have you noticed physician? We always talk about with burnout, purpose, need, connecting to our higher calling. Have you noticed that this is the case now, that physicians have had more opportunity to actually connect with that calling and forget about some of the things that may have contributed to burnout in the past?
Yeah, it's interesting. So my mental model for burnout, right, is that you're climbing a mountain every day when you go to work. It's a tall mountain. It's hard work. And as long as you have the right gear and the right training and the right support, you're up for climbing that mountain, right? We have amazingly trained clinicians who are just ready to go. But when you don't have the right equipment and your teammate isn't there and you've got a pebble in your shoe, right? All of a sudden climbing that mountain is a lot harder and you don't want to do it. So that's my mental model of burnout, right? And if you think of what's happening right now, I mean, the mountain just got bigger. It got taller. It's a higher altitude. It's harder to climb. That doesn't mean people don't want to climb it. They're still there to be the front line and to take care of patients. So it becomes even more important that the equipment is there and ready, that the team is there and ready, and that any of those pebbles in the shoes are removed, right? So I don't think that the added challenge is a bad thing at all. In fact, if you think of a mountain climber, right, having a higher mountain to climb might be something that's motivating, right? This is a challenge and I'm up for it. And this is what I'm here to do. The problems are those pebbles in the shoes haven't gone away necessarily. So we still have challenges to deal with. Maybe there's insufficient PPE at a site, or there's a hospital policy that isn't congruent with what the clinician thinks is going to keep their team safe. And so those are the frustrations in this time, is how do we keep ourselves, our families, and our team safe? How do we do the best that we can for patients? And how do I get the information and the knowledge I need to do this job the best way possible?
And I know, being part of Envision, you guys have done a tremendous job of trying to calm the sea, so to speak, and help people on the front line just focus on what they need to do and not worry about everything else, the pebbles and so on and so forth. We've almost 2 months into this. Have you, and I know everybody at Envision for the most part really has been just super supportive. I know this has impacted you on a professional and a personal level. How are you dealing with it on a personal level? Like, I know you're at home and with the family.
Yes. So I've been baking a lot. And because I've been baking a lot, I've been exercising a lot because I don't want to roll into the office after quarantine is over, and those two things have been very, positive for me. I think also positive for my family because they're not used to having fresh croissants coming out of the oven or sourdough bread. It's interesting. The 2 support meetings that I'm running a day, have made me, quote unquote, meditate twice a day for 5 to 10 minutes. And that is never something I've had as a practice before. It was always sort of a goal. In fact, you've heard me say, Naeem, that it was a goal of mine to become more consistent with the meditation practice. So in an effort to help other people, I've really helped myself with that. And that's been very good and calming to keep me centered.
See this interview, like any words of wisdom?
Well, I think for anyone out there who's managing a team or working clinically or leading a family, make sure that you're taking care of yourself and doing the things that you need to do to have the resources you need to give to others. Because, you know, there's always the tendency to take care of others, to put others before you, particularly for clinicians. And we're in a situation right now that's overwhelming all of our usual coping mechanisms. So we need to make sure that we're doubling down on sleep and nutrition and exercise and self-care things so that we have something left to give.
Well, thank you so much again. This was wonderful, very insightful. I'll send you the link once we post it on our website. And I look forward to talking to you again.
All right.
Take care. Have a wonderful day and enjoy your baking and exercise and the kids.
I will. Thank you, Naeem. Take care.
Bye.
Yeah.